Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Yesterday, I visited the neighbourhood north of the Save-On Arena here in Victoria. It's a neighbourhood the Premier drives through every day on his way to work. And it's a neighbourhood that's in a very, very bad state these days. 3 motels have been converted to supportive housing, but it's hardly supportive. There are no clinical supports for these people. The neighbourhood's being turned upside down by damage to property, by crime, by threats. We talked to a number of businesses, from Dodd's Furniture to Paul's Diner to Java Joe's Coffee Shop, and they all shared the same concern. They want to see these vulnerable people properly cared for, but they are not being cared for in any significant way. They are roaming the streets. Java Joe's has seen their business turned upside down since the Comfort Inn was converted to supportive housing that is not supportive. Extensive property damage, threats to customers, violent threats to Jolene herself, threats to her staff, people defecating in front of her shop. And this is a business that struggled through COVID to even stay open. And this is happening now every day at her shop. To quote Jolanda, who owns Java Joe's, "None of us were told in advance or prepared for this. Because of COVID, we can barely afford to pay our rent or to pay our staff. And this is just tipping the situation over the edge." End of quote. And so, to any member of this government who is prepared to answer in a meaningful way, rather than with slogans or dismissive remarks or generalities, can someone please answer the question put forward by these business operators? Hard-working people like this are barely staying solvent, and now they're expected to absorb this government's plan for unsupported housing. What is this government's plan to provide proper supports?
Minister of Municipal Affairs and Housing.
Thank you very much, Mr. Speaker. And I do understand that businesses, they are being impacted by this change that we've had to make as a result of COVID. Remember, we were dealing with a very challenged problem at a number of sites here in Victoria. And BC Housing is on the ground working directly with these businesses to address these impacts. But again, Honourable Speaker, we need to remember that we inherited a problem, a significant problem, because the previous government, frankly, ignored homelessness. They did not do what needed to be done. So when we came into government, Honourable Speaker, we were really clear that we were going to deliver on supportive housing for people around this province, people who'd been neglected. And in just over 2 years, we have housed, and I just double checked with our team, we've actually housed more than 2,500 people now have a roof over their head. Remember, they used to be in ravines, and they used to be in parks, and they used to be on streets, the Wally Strip and other places. We have moved them over the last number of years, thousands of people into housing. And Honourable Speaker, we have 1,100 more of these homes that are under construction around the province. We have absolutely more to do. No one is saying that we don't have more to do. We absolutely have more to do. And we're committed to working together with the businesses to address their current challenges as we make this transition.
Leader of the Official Opposition on a supplemental.
Sadly, Mr. Speaker, the minister has said 2 things in the last 3 minutes which are simply not true. We visited 7 businesses yesterday. One of them made the effort to go and talk to the BC Housing representative at the Paul's Motor Inn and was told, well, they'll pass it up the line and see what happens. The other 6 have had no contact whatsoever from BC Housing. There is no attempt whatsoever to work with the businesses, as the minister just said. She did not tell us the truth. So let's talk about what Marlon had to say, the owner of a motor car dealership in the area. A massive increase in vandalism to cars he's trying to sell. Property crime, drug use on and around and between the cars and the dealership during the day while he's trying to introduce them to customers. Marlon says, "It's not right that my employees and customers have to worry about their personal safety while they're at work or shopping for vehicles. The spike in crime at my business has been a direct result of the government's purchase of Paul's Motor Inn." Businesses in the area should have been consulted, or at the very least advised of the government's intentions before this decision was made, but so far we've been told absolutely nothing. End of quote. So Marlon's looking for some contact, some guidance, some input, some kind of response from this government for having created a nightmare in the north end of Victoria. It's not getting better. So what is this government going to do to make it possible for Marlon and these vulnerable people to carry on when they're living in a completely unsupported collection of motels that is laying waste to a neighborhood?
Minister of Municipal Affairs and Housing.
Thank you very much, Mr. Speaker. And I have to say what a delight it is to finally hear from the opposition leader that he actually does care about homeless people and making sure that they have supports. It's about time. But I have to say, Honourable Speaker, one of the things that I find absolutely frustrating is that he knows full well, and his party knows full well, I think all the members of the House know full well, how important it is that we work together, that we bring people together to address a significant problem. And we are working with the folks on the ground. BC Housing they are reaching out to businesses to address these concerns. But Honourable Speaker, you don't have to take my word for it. I do think that there are some others who have to say exactly what we have been doing around the province to deliver on supportive housing and the value that it brings. And I want to acknowledge and thank a number of the members in the House who have spoken out and recognized the value it brings. So we've heard certainly from a member from Penticton has sort of acknowledged the value that supportive housing has brought to his community. We have heard from the member from Cowichan Valley. And I want to point out, Honourable Chair, the member from Richmond South Centre took the time to write a letter to her editor around the value that supportive housing has brought to her community in Richmond. And recall, I want all the members to recall that there was some concern about the challenges that come with having supportive housing in community. And, this is what the member from Richmond South Centre had to say. She said, homelessness is not something any of us would wish upon our friends and neighbors. And she was pointing out that we have an opportunity to deliver homes to people in need in Richmond. We all need a place to lay our heads at night, which is safe, dry, and sustainable. Poverty is not a crime. Mental illness is not a crime. Escaping domestic violence is not a crime. We can offer a hand up to people who struggle every day. She went on, Honourable Speaker, to say we have a glorious opportunity to build housing that matters. And she said, I believe the heart of a city is measured by how we treat those most vulnerable. I believe we can make a concrete difference. My thanks to all who make transitional housing a reality in Richmond. So I want to take a moment, Honourable Speaker, to thank those MLAs on all sides of the House who have been advocates for making sure that we continue to do this work. We'll continue to reach out to businesses that have been impacted to address the impacts, to resolve some of the challenges. And we will continue to move ahead to deliver on this critical housing that makes a difference in people's lives. And I would invite all of the members of the House to work with us to bring community together so that these people can have the supports, can have recognition and dignity, and can have some peace of mind while we continue to address how to deliver for everybody who is struggling around this pandemic as well.
Thank you, Minister. Leader of the Official Opposition on a second supplemental.
Thank you, Mr. Speaker. And I think all of us need to reflect on the need to solve problems in this House. Hearing the minister claim a monopoly on compassion is frankly a sad thing. It'd be easy to say it's offensive or it's inappropriate. I was in the clinic at St. Paul's 36 years ago treating homeless people. So there's no monopoly on compassion in this room. What we have to do as legislators is try to address this problem. Let me tell you the story that happened at a mechanic's shop across the street from Paul's Motor Inn. Last week, one of the mechanics discovered a man hidden underneath one of the cars. He asked him to leave. The man came out with a 2-foot-long machete, threatened his life, and chased him down the street. This, by any standard, is unacceptable. And so I'm turning to this minister and this government and saying, if we really are going to solve this problem together, let's have a little less condescension from the minister, a little more talk about those supports that do not exist at these 3 motels in Northern Victoria. Where are the supports for the supported housing?
Minister, Municipal Affairs and Housing.
Thank you very much, Mr. Speaker. Well, I agree with the leader of the opposition. That behavior is unacceptable, and that is a criminal act. And I would imagine that police would be called. Honorable Speaker, what I find really disingenuous and really frustrating and disheartening, I have to say how disheartening it is when the opposition suggests that there are no supports. And so when there, in fact, there are, and that to me is really problematic. And it really creates a wedge in communities and using it on the backs of the most vulnerable in our communities. And that's what I find more than irritating. I find it disrespectful and really troubling. So let me provide an example, if the leader of the opposition can't recall, when his member from Kamloops was certainly parading around this suggestion that somehow there weren't any supports. And so in order to demonstrate that really was not the case, Alfred Ataba, from the manager of operations from CMHA, one of the providers in Kamloops, the member from Kamloops, was saying that there aren't enough wraparound services. There aren't any wraparound services. And so the manager of operations went on the radio, and this is what he had to say. He said, no, I think I would have to respectfully disagree. We have support staff on site doing wellness checks, having life skills training with the residents. There's employment assistance. We have referrals, community services, support groups, and they have access to enriched support from street nurses to the community team through Interior Health. They have pharmacies that deliver meds. There's intensive case management. There's home support. They have a lot of wraparound services. So, Honorable Speaker, I beg to differ with the leader of the opposition around who's being disingenuous right now.
Member North Vancouver Seymour.
Thank you, Mr. Speaker. I too spent the day meeting with local Victoria businesses who are suffering because of this government's decision to warehouse at-risk people without adequate on-site supports. This government has totally let down the most vulnerable in our communities and people who need our help, plus the small businesses who provide the jobs and security for the people who make their living there. Byron Lux of West Coast Appliances said, and I quote, "There was zero communication at the beginning, and there still is no plan. The only support we've received is from the BC Liberals. I have emailed our MLA. Nothing." End quote. This is Victoria, Mr. Speaker, the riding of the Premier, the riding of the Minister of Finance, the riding of the Minister of Education, the riding of the Minister of Agriculture. But they are doing nothing to help these vulnerable people in our community, as well as the small businesses. So my question is to the Premier. Will he finally step up and give those with mental health and addictions the supports that they need?
Minister, Municipal Affairs and Housing.
Thank you very much, Mr. Speaker. Again, what we're hearing from the opposition suggesting that nothing is happening, really? 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 After 16 years of their nothing? 2,500 people now have homes. They're getting meals. They're getting access to services. 1,100 more coming on stream. We have mayors all around this province who are working together with us to deliver. From Kamloops and Kelowna, we have a mayor here in Victoria who is looking for more opportunities to deliver for that kind of housing. We have in Abbotsford, we have in Chilliwack, we have all of these programs in Richmond. We have been going full steam ahead to deliver for people who have been ignored by the other side. I have to tell you, Mr. Speaker, if the other side had done the bare minimum, we wouldn't be where we are right now. This is about us playing catch up, and we're going to keep doing what we're doing.
North Vancouver Seymour on a supplemental.
Thank you, Mr. Speaker. I think it's time that the minister actually went and visited some of these areas all across British Columbia. The situation is so bad that these businesses are losing customers because they no longer feel safe shopping there. Many businesses spend an hour before opening each day cleaning up garbage, discarded needles, human feces, and urine. At one small business we visited yesterday was a young man going through the garbage, And then there was another one that we saw right in front of us, running across the street. He almost got run over. I looked at that young man, and I did look at that young man. I did not look away. And he was creeping away when we approached. He could have been my son. He could have been your son. He is somebody else's son. This government has been a complete failure for people like this young man left to scrounge around in garbage bins. This is in the middle of the day. And the Premier acknowledged the other day his failures, and I quote, "It's not just Victoria and Vancouver where the challenges with homelessness occurs. It's Nanaimo, it's Smithers, Kamloops, Kelowna, right across the province. And that's why we have a Ministry of Mental Health and Addictions working hard to resolve these issues." Resolve? Nothing has been resolved. In fact, we know it's getting worse, and there are no options for recovery. These people are simply being housed in hotels and wander the streets at all hours of the day and night with no supports at all. So again, will the Premier, will the Minister of Finance, who holds the budget in this House, get up and finally admit that this ministry and this government has failed these people, as well as the businesses that live around them?
Minister of Municipal Affairs and Housing.
Thank you. Thank you very much, Mr. Speaker. I find it fascinating that that here we are and the opposition finally decided to take a look at what their inactivity has done and how it's impacted people. Finally, I can tell the members opposite and all the members of the House that when I first became minister, the very first thing I did was look at the tent city that grew under their watch at Sugar Mountain. I went to the Wally Strip that grew under their watch. And the first thing we did as government was put programs in place, bring housing online. We moved 170 people off the Wally Strip over 3 days. We moved them and we gave them supports. Their lives are changed. We did the same thing in parts of Vancouver. We've done it in Kelowna. We've done it in Abbotsford. We've done it in Chilliwack. We've done it I'm trying to think, there's so many, in Vancouver. We've done it here on the island. We have so much more to do, Honourable Speaker. No one is denying that we have fixed everything. You can't fix 16 years of bad in 3. Do we have more to do, Honourable Speaker? We absolutely do. No one is denying that. And I look forward to keep doing the things that we've been doing because we're making a difference in people's lives. And we need to be working together in communities. And there are so many that are happy to work with us. The members opposite aren't that interested, fair enough. But we have mayors and we have business improvement associations. We have the North Shore Business Improvement Association in Kamloops. We have student groups that are eager to work with us. We have church groups that are eager to work with us. We know that there are people in communities right around the province that want to work in partnership with us to deliver for people. It's hard to do. It's hard work, Honourable Speaker. We're bringing everything we have to build community for those who are most vulnerable. I'm excited to keep doing the work. It is hard work, and I know that with the nonprofit sector, with all of the partner groups, we're going to keep delivering and making a difference for these people's lives.
House Leader, third party.
Thank you, Honourable Speaker. Current data ranks anxiety and depression as the 6th leading reason people visit their primary care providers. And that was before COVID-19. As we discussed on Monday, a mental health shadow pandemic looms. With heavy workloads and rapid patient turnover, GPs cannot be expected to carry the burden of the mental health crisis alone. To get additional psychological care, as the Minister noted yesterday, people often have to pay out of pocket, and even then, mental health treatment is poorly integrated into our universal health care system, leading to worse outcomes and higher costs. We can't wait for the federal government to solve our problems when there are solutions available to us in province. Because every dollar spent on mental health care saves our medical system at least double that, one solution is to better integrate primary care psychologists into primary care clinics. Despite their mental health expertise, psychologists are currently ineligible to provide their services through MSP. My question through you, honourable speakers, to the Minister of Mental Health and Addictions. Will the Minister work with her colleagues in health and finance to create a 12-month pilot project that would allow psychologists to work alongside primary care physicians and be eligible providers through a government-funded billing system for consultation and psychotherapy?
Minister of Mental Health and Addictions.
Thank you, Honourable Speaker, and thank you to the member for her questions, and thank you for the opportunity to talk about our government's work in this area, both to support people through COVID-19, but also to build a system where access to mental health care and addictions care does not depend on the size of your bank account, which is very much the legacy that we have been left. And we're not waiting for the federal government. We believe they need to step up to the plate, but we're not waiting for them. And that's why we were very excited to partner with Dr. Lutz and the BC Psychological Association early on in the pandemic, where they stood up 250 psychologists to support people who are struggling with mental health issues. We also partnered with Canadian Mental Health Association BC, with Foundry BC, and with 49 community agencies across the province to whom we provided funding to be able to provide no-cost or low-cost counseling to thousands of British Columbians. And we know how important this is, Honourable Speaker, because all of the surveys and the polling indicate that the pandemic has had a significant impact on people's mental health, and it will continue to. That's why I spoke about an echo pandemic earlier in the week. Nearly half of British Columbians report that their mental health is worsening. And so that means that we have focused programs to support people who are working on the front lines of healthcare. It's especially having an impact also on young people and on seniors. And we're working right now in our ministry, Honourable Speaker, on what further supports we need to provide for people who are struggling with mental health issues. We're hearing from many of our partners, including the BC Psychological Association, and we look forward to further discussions in order to make decisions about what we need to do going forward to support people through this pandemic and beyond.
House Leader, third party on a supplemental.
Thank you, Honourable Speaker, and I appreciate the Minister's response. However, a patchwork of programs and services is different from integrating mental health care right into our universal health care system, which is what we're advocating for. As Dr. Leslie Lutz, Professor of Psychology at UBC Okanagan and Executive with the BC Psychological Association, has advised, funding this pilot project would truly begin to change the way that we treat mental health in our province. The project itself is not entirely untested. In Ontario, a group of psychologists and family physicians secured funding that established a practice model based on collaboration between family physicians and psychologists, and over a 12-month period, the data collected showed impressive results. We all hope to build back better after the threat of COVID-19 has passed. To do that, we must prioritize everyone's mental resilience. My question again through you, Honourable Speaker, is to the Minister of Mental Health and Addictions. Given our concurrent physical and mental health pandemics, can we expect this government to review this 12-month pilot project proposal, which, in addition to greatly helping patients, could also help us transform our healthcare system into one that encompasses both physical and mental well-being?
Minister of Mental Health and Addictions.
Thank you, Honourable Speaker, and thank you again to the member and the leader of the House Leader for the third party knows very well my commitment and this government's commitment to get to a place where we have equity between physical health and mental health. We certainly welcome the proposal from the BC Psychological Association, and we will be engaging with them further, as we will be engaging with a number of our partners who also have proposals. And absolutely, we need to go beyond the kind of system that we inherited that is very much a patchwork system. And that's why we intervened very quickly as a government when the pandemic hit. Within 2 weeks, we stood up programs, worked with the BC Psychological Association, but also worked very importantly with Foundry BC, which we're expanding to 19 locations across the province, Thousands of people have accessed those services. The Canadian Mental Health Association, we've significantly expanded support to them over the past few years and supported them to stand up virtually, and they have reached thousands more people than they reached before. We have a new 24/7 advanced student helpline for students in post-secondary education. Never existed before in the province, Honourable Speaker. Programs like Confident Parents, Thriving Kids, delivered by CMHA, are reaching more people than they ever have before. And we have a really, really solid project happening with Safe Care BC, CMHA, and frontline healthcare workers and their unions to ensure that people on the front lines who have been bearing a lot of the brunt of this, including the mental health impacts, get the support that they need. So, and just this week, Honourable Speaker, we opened the Royal Columbian Hospital Mental Health and Substance Use Wellness Centre, a significant addition to the continuum of care for mental health and substance use. And Honourable Speaker, we've got more announcements to come in the coming days that I know that I know that both the opposition and the third party will welcome, I'm sure, and we look forward to hearing a positive response to those upcoming announcements.
So next it's member for Oak Bay Gordon Head, and don't worry about the time because I'll be allowing your supplemental.
Honourable Speaker, I must say, I've been here 7 years, almost 8 years, and this has set a new record. We've just finished 3 questions, and there's only 4 minutes left in question period. I'm not so sure this is the way this place is supposed to function, and I'm a little disappointed in my colleagues for taking that up and shoving me to the last couple of minutes of question period here. It's unfortunate the answers were not targeted, and the questions were rambling, in my view. Anyway, as more and more evidence about the role that masks can play in reducing the spread of COVID-19 has emerged, growing numbers of jurisdictions have adopted laws making face masks mandatory in all scenarios where it will be difficult for people to remain physically distant. Just last week, Honourable Speaker, France introduced measures mandating masks in all enclosed public spaces. Across the pond, the UK began implementing a law that makes masks mandatory in grocery stores, shopping malls, post offices, banks, and other busy establishments. And here in Canada, Honourable Speaker, Quebec has made masks mandatory in indoor public spaces, while Toronto has established similar rules. And masks will be mandatory in indoor spaces in Nova Scotia starting this Friday. A recent poll from Angus Reid has found that there is broad provincial support for rules that would make masks mandatory in public spaces, with over 70% of British Columbians in favour of the changes. And although not all members of the public would be able to adhere to these rules due to underlying physical or mental health conditions, the vast majority of the public would be able to follow them with relatively few personal costs. So my question through you, Honourable Speaker, is to the Minister of Health. Given the evidence in favour of universal wearing of masks and the broad public support for such a measure, will this government implement a law or public health order that makes masks mandatory in all indoor and crowded spaces outside people's homes, and if not, why not?
Minister of Health.
Thank you very much, Honourable Speaker. I want to start by expressing my appreciation to the member for Oak Bay Gordon Head for his consistent and thoughtful support for public health measures during this pandemic. It is much appreciated, and I thank him for his questions. He will know that Dr. Henry has answered this specific question a number of times in the past few weeks. Let's see how I do, Honourable Speaker. He'll know that in July we understand right now quite a bit about community transmission of COVID-19. It's why we've taken specific public health measures. For example, public health measures to deal with houseboats, to deal with temporary accommodations, to deal with rental accommodations and resorts, to deal indeed with bars and with nightclubs, and even with strip joints, Honourable Speaker, and specific steps to deal with what is a significant issue in agricultural industry. Dr. Henry doesn't believe, and I don't believe at this time, the community of transmission in BC justifies a mandatory mask mandate, not at this time. And we think that it would not be justified in light of the significant challenges in both putting it into place and the very significant exemptions, which I know the member would understand, that would be required to do so. He also knows, Honourable Speaker, I know we have a little bit of time, he and I, for these questions. So I'll just give him a little bit more information that masks are, well, very important in terms of the hierarchy of measures we can take, is less effective than physical distancing and barriers and administrative measures. But that said, Honorable Speaker, Dr. Henry recommends, and I recommend, wearing non-medical masks in circumstances where physical distancing cannot be maintained. I wear a mask in stores. I wear a mask in grocery stores. I wear a mask on public transit. I think in these times, in particular in these times, wearing a mask is a reflection of good COVID sense, but also a reflection of community respect. And many businesses, in fact, which have small spaces, are mandating masks within their businesses, within their COVID-19 plan. I want to assure the member that this is our view for the moment, that we consistently have adapted based on the evidence, and we will continue to do so. And the efforts of Dr. Henry, of public health, of the government, and indeed of all the people of BC will continue to be founded on evidence and on science, and I know he appreciates that.
Member Oak Bay Gordon Head on a supplemental.
Thank you, Honourable Speaker. I do note that the member opposite said my question was 1 minute and 30 seconds long, and I just will say that indeed it was, and then we should have been able to have 20 such questions in this period, but we're not getting to it. I think the Minister, I'd like to thank the Minister for his response, and I do appreciate government's reservations about imposing a law that would make masks compulsory, and government should be commended for the job done so far in limiting the spread of COVID-19. But lurking, Honourable Speaker, in the background of discussions about masks and COVID-19 are concerns around the potential for government overreach. And I understand that there's a slow pace, but however, we're sitting in once-in-a-century pandemic. Measures will need to be taken that will temporarily restrict some of our normal freedoms in order to preserve our collective safety. One study, for example, that I referred to earlier in statements today shows that even with a 50% efficiency, instead of a 95% type efficiency of most masks, you still get a lower R rate number than you would without wearing masks. And since enforcing regulations around mandatory masks is frankly impossible for any government to handle by itself, many jurisdictions have appealed to the private sector to help these rules, like in Quebec, for example, where periodic inspections happen in place. And in instances where individuals or businesses are caught, the authorities have typically been empowered to apply fines. So my question through you, Honourable Speaker, is once more to the Minister of Health. If government does so choose to take this public mandate to require masks, how do they plan to implement and enforce said rules in the province of British Columbia?
Minister of Health.
Well, thank you, Honourable Speaker. And as noted, and this is the strong view of public health of Dr. Henry, it's my strong view that at the moment, a mandatory mandate for masks is not required, is not desirable in British Columbia for some of the reasons that we have discussed at length. And I'm happy to continue to discuss because I think it's an issue of public interest and debate. I applaud people who take the steps because I think it's an act of respect to wear non-medical masks, especially in areas where physical distancing can't be maintained. That is of vital importance, and it is part of our collective response to COVID-19. What we're going to continue to do in BC is follow the science and follow the evidence in our pandemic. Yes, what happens in Quebec and what happens in France and what happens in Alberta is important. But one of the reasons we've been successful in BC is our determination also to follow our own BC course to deal with our own BC pandemic. That led to our response in our single site order in long-term care. It led to our action different from other jurisdictions in dealing with temporary foreign workers in agriculture. I think these sorts of steps, which demonstrate a commitment to public health and to breaking the chains of transmission, have been what have made us successful. But I want to say this. I appreciate the comments of the honourable member, and I want to take this opportunity to thank all the members of the House, because people have consistently made positive suggestions, been supportive. This has been our response, our collective response to the COVID-19 pandemic, and it has been successful so far, I think, with extraordinary challenges and with some considerable losses. But we need to continue to do this together. There are weeks and months and maybe years to come, and that will require generosity and positive spirit together to continue to do that. So I encourage people to make suggestions, to engage in public debate on these issues, but mostly to be respectful of one another and to all of us to take our responsibility, as the government is, as we as a legislature are, in breaking the chains of transmission of COVID-19 in BC.
The bill ends question period.